Today we're talking about parvo. What is it? How can it be treated? How can it be prevented? Hi, I'm Michelle Spranger, and I'm a board member with Michigan Pet Alliance. To help answer our questions about parvo, I figured, why not talk to a veterinarian at the biggest animal shelter in Michigan? Every year, Humane Society of Huron Valley in Ann Arbor cares for thousands of pets in their adoption center and vet clinic, thanks to the life-saving work of their more than 100 employees and more than 2,000 volunteers.
I'm Dr. Courtney White. I am the Vice President of Veterinary Medicine here at the Humane Society of Huron Valley.
Let's start right at the beginning. What is parvo?
Parvo it's a virus. It can be a deadly virus. It can be fatal if not addressed quickly and appropriately. It is transmitted through oral, nasal exposure to infected feces.
Does parvo affect cats and dogs?
Yes and no. The canine parvovirus does only infect dogs. However, panleukopenia is a similar parvovirus that affects cats.
What are the symptoms of parvo in dogs and how is it diagnosed?
Unfortunately, they are fairly vague clinical signs initially. It might be lethargy, vomiting, diarrhea, specifically bloody diarrhea or a diarrhea that has a very foul smell, which is typically the blood that you're actually smelling. But some people will smell it and say, oh, that smells like parvo, and it's usually blood in the diarrhea that they're smelling. Not eating. Those are the most obvious clinical signs that when we have a puppy or a young unvaccinated dog, that kind of ring those alarm bells when we hear that. And it can be one, it can be all of them.
If you're enjoying this video so far, please hit the subscribe button. So when a dog is presenting with these symptoms, how do you determine if they can be treated? What's next step?
We'll look at our signalment. So parvo typically affects young unvaccinated dogs. That being said, it can affect an older, potentially unvaccinated dog, or maybe even an older yet immune compromised dog. But it's these young dogs, less than 6 months, unvaccinated, that are going to be our largest population that's at risk. If they present with the signs, especially a combination of signs, we might not automatically test a puppy that's looking a little dumpy, but if they're looking a little dumpy and not wanting to eat, we might go ahead and test. So it's a combination of the clinical signs that they're presenting with and their signalment. From there, we do an in-house SNAP test. We use the IDEXX ELISA SNAP test that tests for canine parvovirus. And that is typically used with a fecal sample. If we have a fresh fecal sample, we will do a swab of that. If we don't have a fecal sample, we might do a rectal swab with it, or some people do a laryngeal swab. So when we then do receive a positive test, we will almost always attempt treatment unless the dog is at a point that they are suffering or we fear that they're close to death. These puppies can miraculously improve with treatment. It might take time, so more often than not we will try unless they are close to death or suffering.
How do you treat parvo?